Okay, so let's get started at this moment. Good luck, everyone. Remember, play on your phone. You see the right answer, go for it. Last warning, Kahoot does not allow me to put full answers. It's very limited. So I have to be very creative, and you too have to be very creative to pick the best answer out of the four. So it's a short, it gives me just a little bit of space. So of course, on the test, you wouldn't see such a short answer, okay? But be mindful of that when picking the best of the four answers. Again, do your best to pick the best answer. Good luck, everyone. Let's get started at this moment. Should be all about ethics, legal principle, and culture of care, which is domain number 5, ANCC. Good luck. Okay, I can see why the confusion, right? But remember, what did we learn yesterday? That we read, what are the 3 patients right? Least restrictive environment, right? Confidentiality and informed consent, right? So anytime on the test, I'm going to be very broad here. Anytime you see an answer that has safety planning, this is high yield. What is safety planning? In short, least restrictive environment. Not really, but it's a way to protect the patient instead of immediately admitting the patient, whether it's suicidality, whether it's manic event, right? So anytime you have an option to collaborate with the patient, which is exactly what you're doing, create this, work with the patient. So you're collaborating, same thing as collaborating, and create a safety planning. This is a very strong answer. These are 2 key words that make it almost every answer correct. Okay. Now, I can see why a lot of people pick start then involuntarily hospitalization immediately to protect the patient and the public. That sounds good, but that doesn't really happen like that. It didn't necessarily say it was an imminent danger. It was possible danger. Okay, but watch out for working with the patient, collaborating with the patient, and watch out for safety planning. These are very strong keywords that the board loves. Okay. And remember the cases that we discussed yesterday, O'Connor versus Donaldson, that someone was in the hospital for 15 years and it was ruled out that being mentally ill alone does not give anyone the right to detain the patient. Remember the orbis corpus, what it means, right? That one should not be detained without due process. Okay, so this is how questions could come up. We learned the cases and now it's application. And this is true for everything that we learn. I give you the definition, but then will come the application. This is why doing the work on your side and then coming to the live class so we can iron out those issues, okay? But always collaborate with the patient to develop a safety plan to engage them in the decision-making process, okay? Go ahead, glides.
Dr. Lopez, can I get the code for the pin, the
Okay,
game pin?
I'll put the king. I'll put it in the chat box, okay? Now,
Thank you.
I want to also call attention for something else. Administer a high dose of medication to rapidly control the manic event. Why am I circling this? It's for one instance. Questions exactly like that, but it's talking about medication. Option A is going to be lithium, okay? And half of the patients taking the board will pick lithium. The other half, that is you will pick a SGA, second generation antipsychotic. But why? If lithium is the gold standard, doesn't make sense, does it? Well, let me tell you why. Because lithium has a narrow therapeutic window. In order for you to decrease the manic event, it's going to take days. And if you go too high, it can be very dangerous. So, what in practice, what a lot of people do, and this really is in a lot of clinical guidelines, start with the second generation antipsychotics or Depakote, one of the two, bring the manic down, and then transition to lithium. Okay, so this is very important because it's very like questions like that to be on the board and ask which medication to give. Option A, always easy to get to be a trap, will be lithium, and then it's not the right answer. Okay, all right, so hopefully that helps. Let me go ahead and put the code here. Someone asked the code, so the code is 2957154. And I can see this is a very hard question for that reason, okay? All right. Oops. Oh, somebody muted. No more music. All right, so perfect. So, all right. So really the option here is between the blue and the orange, right? Here, the only thing that's really differentiate the blue and the orange is, okay, you don't want an admission? Fine. Outpatient treatment, right? But we're not really addressing and advising the patient as, I understand you don't want admission, but these are the risks and things that could happen to you if you're not admitted.
I see.
Just because you are respecting the patient's wish, it does not negate the fact that you need to provide education of option A or B. What you do not want to do is forcefully admit the patient, unless if there is a clear, imminent danger to themselves or others. Does that make sense? I know it's kind of like
Dr. Lopez, I
Yes,
didn't understand this question. I didn't, because if I was in the exam, the right answer is B to me. Because even though I respect the autonomy, I need to explain the risk to
right.
patients. So I'm just so confused about this one.
So that was the right answer.
Oh, which one? B was the right
Yes,
answer?
yes,
Oh,
right,
oh,
right
okay.
here. B is the right answer. So you want to balance the principle of respecting patients' autonomy,
Oh,
but
okay.
ensuring their safety. That's good. You got it right. So you rejoice.
Dr. Lopez.
Hi.
Hi. That's the first time I came. So I think I pick D, but I saw one of the question like that in the
It was,
Quebec.
yeah.
Yeah.
I can't answer what is in the Q bank. It's thousands of a question. You're gonna have to send it to me. I bet it was not like that.
Okay. Okay.
Email me, okay? So I
Okay.
can take a look at it.
Okay.
Dr. Lopez,
Yes.
I'm playing with my phone, but I don't know where to record my answer on my phone. Can you help me with that, please?
Okay. So you have to log in the game. I'm going to put the address here in a chat box, but we really can't stop once the game begins. Let me put a pin code. Once you type it in, enter the pin code, pick a nickname, and then you'll be in the game. Okay. I can't stop at this moment because it's a live game. But if you have a question, chat with me in the chat box here. Okay. All right. Next question. All right. Okay. So why, if someone is on the SSRI for the past 6 months, I can see how this question was poorly written because it should have said Zoloft 50 milligrams or Prozac 20 milligram or citalopram 10 milligrams or Praxol 10 milligrams, right? Because that would kill you. That is an initial dose, and perhaps you should increase the dose. But in general, the question said had minimal improvement or some improvement, right? So what you want to do now is double down, go to the next level. In practice, it's always good to max it out the medication before you add something else into it. So you keep increasing the medication, assessing over time, looking at your scales over time, a trend, and then you keep increasing. Now, adding psychotherapy could be a great choice, but usually after you have maxed that out, one modality, which would be the medication. Okay. Right. So you can see how PMHNP was on the top and she lost the ranking very fast. So you have to be extremely fast and correct in order to maintain the podium. Okay. So adjust the SSRI's dose and continue monitoring her symptoms. This option may be considered if the patient's symptoms have not improved or worsened on the current SSRI. Now, caveat to that. Let's say a question is just like that with a small tweak. What is the small tweak? That the patient was on SSRIs, was doing well, now reports that she's not doing well. Very similar, right? Then your job is to assess why, what happened. And usually the answer is social dynamics, social influences, right? Because usually that is not a medication. If the patient was doing well and all of a sudden is in a dump and not doing well, you need to assess. Usually they're looking for what else has happened that caused the patient not to do well after doing well in a long period of time. The third caveat to this is uh, initiate immediate hospitalization due to suicidal thoughts. That's not a thing after someone's been on the medication for a while. Now, starting the patient on an SSRI or any antidepressants and following up visit, the patient says, I'm actually doing okay, I'm doing great, but I develop or more constant or more intrusive SI, suicidal ideations, suicidal thoughts, then you need to stop the medication, right? Because that is a FDA warning, right? A black box warning that SSRIs could cause increase in suicidal thoughts, right? So remember the two examples that I just gave you. Someone starting on the medication, develop suicidal thoughts, your action should stop. Second case, someone is doing well on the medication and all of a sudden reports not doing well. So now is not the time to increase the dose, but is the time to assess the why. And usually psychosocial influences, marriage, jobs, something else has happened that brought the patient down. So remember those two cases, very important, very likely to, in some shape or form, in some kind of scenarios, they usually play out on tests very often. All right, so if you pick B, and that don't mean to be funny, but hopefully it's better now than later, get ready to be sued, okay? Why? And I don't mean to be, mean or funny in any shape or forms. If maybe it was a misunderstood of the question. He is 19, right? We cannot inform the patient's family. He's 19 years old. He's an adult. Okay? So, and maybe this is just there was a fast question, right? But just remember, this is very important when we're dealing with teenagers and when we are dealing with adults. Let me give you an example. I just learned this yesterday. Yeah, yesterday, because I worked yesterday. There is a psychologist at my work, and the psychiatrist walked in my office and said, the leadership came over yesterday and they give us a talk in the clinic. about open notes and things. And then the psychologist, she was pretty aggressive, right? And then after the meeting, I went to my office, and the psychiatrist went on, and we talked. And I'm like, why is X, Y, and Z so aggressive today? And she said, because she was sued for over 2 years, and the hospital leadership didn't quite help her out, right? That what brings me in the point that sometimes when you get involved in hot waters, the rope always break at the weakest link. Okay, so don't be afraid to always take the caution approach rather than going above and beyond. So what's above and beyond? Let's say you are giving lamotrigine. About a month ago, I got a patient on lamotrigine with a dose of 250. That is above the recommended dose. Why would another Psych MP do that? Go above and beyond. Protect your license, okay? Don't go above and beyond, above what's the recommended dose. Otherwise, you are going to have to prove it through research why you did that, right? So respecting the patient's confidentiality and refraining from informing the parents. 19 years old. Now, my other point to this is you want, especially with the teenagers, not this case, to maintain confidentiality as much as possible. And that's going to put you in a hot seat both ways. One, you want to maintain confidentiality because of the patient. And the second option is you want to tell the parents because you are concerned. So what do you do? Really, it depends, right? If it's a safety issue with the patient, you don't have no option. Remember, we are obligated to inform and protect minors and elderly. Now, what if it's using weed? Do you tell or not tell? Can you put your answer in the chat box? N or Y? What would you think? No, 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 not at all. No, no. Okay, I like that. Perfect. What if she is a 15 years old and she's having intimate relationship with a 16 years old female? Would you tell? No, no, no. Okay, great. Oh, somebody said yes. Somebody said yes. Why would you tell? Kay or anybody else who wants to speak to that? You wouldn't tell, okay? That's her preference, right? Up to 18 years old, still minors, okay? Because here's the thing, the moment that you do tell is the moment that you lost the patient forever, okay? So how do you gain trust with teenagers is by maintaining confidentiality. By no means, if there is a danger situations, is not an option whether you should you tell or not, okay? Very difficult questions. Very difficult questions because sometimes we want to tell, but we shouldn't. 16 years old, right? We got 10 seconds. Pick your best answer. All right, perfect. Again, as I mentioned, those questions are hard. That's why doing the question bank will kind of help you find your rhythm for questions like that. So let's review this by memory. 16 years old, depression, self-harm behaviors, and suicidal thoughts. That is the essence of the question, right? Should we tell or not? In this case, we have to, is a safety concern, right? Is a safety concern. So notifying the parents about the situation without consent is a no-go. That's out of the question, right? Without, yeah, without patient consent, right? So not possible this time, right? So we want to always find the happy medium. So what would be the happy medium? Respect the patient confidentiality, do not share with the parents. So these are the two extreme, right? I'm going to say it and I don't need your consent. No, I'll keep the parents outside the loop. I'll keep this between me and you. What's in the middle there? Work with the patient to weigh the benefits and drawback of the disclosure, right? So basically, what are your concerns? Can you help me understand what are you afraid of? And what do you do at the beginning of the interview? You do a disclosure, right? You do a disclosure that everything you say between will stay between you and I, unless if you are dangerous to yourself or others. And this is why you do it in the beginning of the meeting, the first time. Granted, they always forget that you mentioned that, right? So that when situations like this come, you're not you already give a warning ahead of time. Okay, again, very hard questions, right? Cultural questions are hard, uh, but the more we do it, we find a rhythm to move forward, okay, on how to answer those questions. And request a court order to disclose the patient's condition to the parents. No. Okay, would be nice in an ideal world that we can call the judge and be like, hey, this is the situation. No, it's not going to happen, right? This is not there yet. So the most ethical course of action in this situation is to engage in a collaborative discussion with the patient. The PMHNP should explain the importance of involving the parents, explore the potential consequences of not involving them, and make every effort to gain the patient's informed consent to involve the parents in their care. Okay? So one was a too strict, no, I'm not going to say it. The other one was like, I don't care what you say, I'm going to disclose. And the happy median answer, let's compare the pros and cons of disclosing versus not disclosing. What are the benefits? That way you still try to get the buy-in or at least inform them. At the end of the day, once you had the conversation, at least you had eye-to-eye conversation with the patient, and the patient says, no, I don't want to be disclosed. You're going to have to make a decision, but you do not want to make a decision behind the patient's back. You want to, let's talk, let's collaborate, let's find a happy medium here, right? At least you give them a warning that you have to uh, report this case because could be dangerous for the patient. And most of the time, they're okay with that after you talk to them. Initiate a admission. Didn't give me enough space, okay? All right. So this was not even about medication, right? It was about possible admission or not. Okay. So here was focus on promoting the patient's well-being, use strategy. Um, I believe was for the admission process, right? Promoting patient's well-being, use strategy to engage the patient in collaborative decision-making process, regardless of regarding medications. And here is the why. We talked about this yesterday, very in depth. All right. So I was hoping that no one would pick this, right? Because the question had um, autonomy should respect the patient's request for benzodiazepine, right? If someone had a adverse reaction to benzodiazepine, would you give benzodiazepine? No, right? If someone had adverse reaction to that, so what do we say? This is a very common question, non-maleficence, which is do no harm, right? Do no harm. How are you going to do no harm? By preventing the patient from getting that medication, right? Veracity, inform the patient about the potential risks and side effects. True, you are telling the truth. That is no doubt, but that is always a trap. A lot of questions on the board will have a true statement. But is this what the question is about? Is it about telling the truth or is it about safety? Right? So as a better answer would be non-maleficence. This is a very, very type of questions. They're very, very common. And they usually come with uh, Wellbutrin, Trazodone, Adderall, or benzodiazepine, right? For obvious reasons, benzodiazepine and Adderall because of potential for abuse. Then you have priapism, right? So you wanted to withhold the medication and cause no harm. right. Oh, I didn't take a picture of this question here. Uh, respect the patient's choice and involve the family. Let me take a look here on the answer. Respect, which involves honoring the individual's right to make decisions about their health care, should be prioritized in this situation. Respect the patient's autonomy means involving the family only if, that's what I was looking for, only if the patient gives explicit consent during that choice and preference are respected. Don't remember if the question uh had the option that the
So
patient
the
didn't.
question, Dr. Lopez, the
Yes.
question didn't say anything about the patient
Okay.
giving any, like they didn't talk about the patient at all. So that's why I went with D, just
Yeah,
to like give a broader answer of like, I didn't want to assume, hey, the patient didn't give consent or the patient did.
yeah, you
Can you
absolutely
explain
right.
that to me? Like, so next time
No,
I
no,
don't get it wrong.
you absolutely 100% right. So the question should have given what the patient wants, explicit, for sure, in order to make it a fair decision, because both answers were correct in their definition, I believe, right? But yes,
Yeah, because it said that the family
wants.
believed that they couldn't make informed consent. It didn't state that the patient couldn't make informed consent.
Absolutely, yes. The question should have mentioned whether the patient wanted or not, and then the four choices to go along with that, for sure. Thank you there for the feedback. It says I thought it said the family felt. Yeah, I don't usually have my phone with me and I take a picture because it's always hard to go back. Sometimes can be a little detail, and I don't have my phone with me, so if I can't go back to the question. It doesn't allow me to go back here. Otherwise, we would have read the question again and kind of make a little bit more sense. But I don't remember reading about uh, the patient's wish or any cues of what the patient wants.
Yeah, there was no patient's wish, only family's wish.
Correct. So in that case, I think there was two possible correct answers there, because it didn't give you one way or another to go by, right? So sorry about that.
And I have a
Oh,
question. So,
I can't
oh,
stop
okay,
now,
wait.
but I will come back right after that, okay?
Dr. Lopez is too small. Can you zoom? I
Yes.
cannot read. It's too small.
Is it better?
It's too
Is it
small.
okay? I was trying to make it better, but you can make it larger on your computer. If you are using Google, it should be like three dots on the right hand side, and you can make your computer, um, you know, 175 screen a little bit larger. Okay, so sorry about that. So what I wanted to mention about this question here is out of state, right? Remember yesterday I kind of went a little bit above and beyond to mention about protecting the health, uh, protecting the patient charts, but also one of the biggest problems that we are having with telehealth is, if I live in New York, I mentioned if I live in New York and my patient is in Maryland, vice versa, doesn't matter. We cannot prescribe, right? So this is very important. I have a friend of mine, he's a psychiatrist, and he works in Boston, and he was hiring few NPs from Florida. And I'm like, man, he's a very good friend of mine, very personal for many years. I'm like, you need to get your stuff really straight, because you hire all those folks from outside and they're providing care in other states is going to get you in trouble someday, right? So be careful. If you're licensed in one state, right, you can only provide care in the state, unless there is an agreement between in-state, maybe unless was during COVID time, there was a lot of agreements going on. But in a usual sense, you can only provide care where you are licensed, right? So, okay, let me go to the next question here. All right. So we have up to 19 places. ME is the highest climber. Wow. Here we go. So licensure is critical legal principle that dictate the scope of practice for healthcare, providing the situation of PMHNP out of the state is not licensed, is not recognized in the new state. So therefore, you are legally making it illegal to prescribe controlled substance or any medication. It's not illegal because it's controlled substance. It's illegal because you're not licensed where you are providing service. Okay, so what I wanted to warn you guys is this is one out of the big deals that are happening right now, and is very likely to be on your board, because this is an ongoing issue. People are hiding their IP address. They're doing all kinds of things. And this has become a legal issue with telehealth, right? So please be on a watch out for questions along those sides of licensure, what you can and cannot do. And what we do, we find with the scope, with the state, what we can and cannot do. Okay, I was hoping for 100% on this one, right? Anyone wants to speak of why this is not the right answer? Maybe I can provide some insight. Maybe it was a wrong fast play. But recap, is a 9 years old. You already assessed the patient because the patient's telling you, I am being physically abused. Usually, what I ask you guys is not to rush into reporting, but conduct an assessment. In this case, the assessment has been conducted because the patient is telling you he is being abused. That is your assessment, right? The next logical process will be to report. So why is that important to begin with? Well, let's say you look out through the window and you see someone playing sexually with the doll, right? Are you immediately, it is a sexual abuse, let me call CPS? No. In that case, if it's given the opportunity to assess and then make the reporting, that's what you do. In this case, the assessment already has been done. There was a physical findings. The patient's telling you, now is reporting, right? Why not A, right? respect the child's wish is a 9 years old. What if you respect the child's wish and the worst happen? Can you live with that?
No.
How about the green one? Counsel and support the child while monitoring the situation. Well, are you going to sit down and wait for the situation to develop and monitoring? Who knows what's going to happen tonight, right? And the same thing is the blue options here, schedule follow-up visit. Not a good option, right? It's a 9 years old being abused. You do not want to go home thinking about this patient. You have to do the right thing. Now, it could be that your right action still end up being a bad outcome, but you are protected at that time, right? You took the hard route and reported. At minimum, you have what you stand on. It's something to stand on because you are mandated reporter for elderly and children, right? Don't let the 9 years old influence you, because he's trying to mitigate, or she is trying to mitigate for the situation of what could happen at home, right? But it's already happening. So mandated reporting law require healthcare provider and professionals, including PMHNPs, to report suspected child abuse to the appropriate child protective service. Same thing, right? The one time that I almost went to court the day of, or the day before, 24 hours before, was when someone told me something that they should never have told me. At that moment, I have no options but to turn the person to the legal authorities. And this is why I disclose that very clearly, that I am here for you, that I will maintain confidentiality, but there are certain situations that I cannot and will not maintain confidentiality. But what happened is, after 10 sessions, the patient becomes very open and then disclose things that I should never hear. Because if I do hear, I do not have an option other than doing what I'm required to do. Okay. Yeah. They are not 18 years old and they are not adults until 18 years old. Absolutely. Yeah. That is still a minor unless emancipated, right? So what is an emancipated minor? Is one that's younger than 18, maybe already married, living outside the house, fully supported, self-sufficient, should I say, right? Not dependent on the family. But I'm glad that we're making those mistakes now, okay? So that we don't make them during the test. Okay. So let's discuss that for a minute. Someone disclosed homicidal ideation. Why not the green? Continue therapy, ensuring the patient feels safe and supported? No, right? That cannot be the right answer. How about the red? Respect the patient's confidentiality and do not disclose the homicidal ideation that I'm going to kill someone to anyone? No. How about the blue? Inform the patient's family. Again, it didn't even give you an age on the question, but informing the patient's, even the wife doesn't, or husband does not have 100% legal right of my chart. My wife does not. If I'm in a hospital, if I don't want her to know, hopefully she's not hearing me right now, she's not going to know. I mean, it's my chart, right? It's my health. Just because she is my wife, it doesn't grant her the right to assess my health care records, right? So we cannot disclose anything to the family.
Dr.
Now,
Lopez,
yes.
we heard you just say she's not in here right now. Don't think we
Oh,
didn't
is
catch.
she? Oh, okay. Yeah, I'm like, is she's here? No, what I'm saying is that even a spouse do not automatically have the right to obtain the other person's medical records. Even the spouse, right? That's what I'm saying. Yeah, she's not here, right? Okay, so it cannot be those options, right? So contact law enforcement is always the right answer. What is the second right answer for the test? Contact the board of nursing. Why? Because they dictate the scope of practice. Remember, the Tarasoff principle, or the duty to warn, is not applicable in every state. You are testing for a national board, right? Applicable to every state. You're testing, you're getting your certificate. Doesn't matter if you took the test in Utah, California, Miami, doesn't matter. It's applicable to everywhere, the certificate, right? So the questions must be applicable to everyone. So if the Tarasoff principle is not applicable to your state, then you cannot contact the imminent possible victim. So what is a safety answer? Contact the law enforcement or contact the board of nursing, okay? Because they can, and they are the ones who dictate the scope of practice, okay? So I'm trying to really make it a point to not directly inform the victim here because it's not applicable in every state. A safe answer, calling the police or calling the state board of nursing. Usually those are safe answers. What are the exception? The exception is client comes to you and say, I am going to put fire in my nursing home, right? That is a lot of people, right? Sleeping tonight. So, if it's an imminent dangers of that catastrophe, of that large tragedy, you have to take action. But the more common scenarios is, I'm going to hurt John. Wait a minute. John is actually my patient. I happen to have John's phone number right here. So the question is now really, should you or should you not? Is more asking you, what is the Tarasoff principle in that sense? Okay, which is duty to warn. Kind of, you see the questions may go out of the way. You already have the John's information. You know John, right? So it's telling you basically, do you understand what the Tarasoff principle is? Very hard questions too, right? Because no matter how much we talk about it, people still seems to get hung up on those questions. But remember, calling the police, calling the state board of nursing are safe answers, okay? Because you can call the police in any state. You can call the state board of nursing in any state, and they will tell you what is your scope of practice in California, Florida, Maryland, and so on. All right, yesterday we said we got to know people by the letter. Let's see if we actually got that. Can we get 100%? It's hard, right? All right. So I put the red and the blue on purpose to be similar, very similar, to see how many could I trick. How many students could I trick this time? So what I did is P is problem or patient population, right? What's the problem we're trying to solve, or what it is the population, patient population we are trying to do. Then I is the intervention. And then I switch C for clinical on the red versus comparison, and then the outcome and the time frame. I was extremely specific yesterday, the things that you need to know by the letter. What are they? Cage, you need to know by the letter. Imagine you get 4 options where the C is different things, the A is a different things. You might be confused if you do not know PICO by the letter. And questions like this come up, you just lost a very easy question. What else you need to know by the letter? Frame. What else we need to know by the letter? PDSA that we covered yesterday. So folks, I'm not trying to annoy anyone, but I'm trying to warn you ahead of time. Okay? So knowing PICO, and when I say knowing is really knowing, it's not kind of knowing, because all of you guys kind of knew it, but look, just about half of the people, 26, 13, and 12, got it wrong. 50%-ish, right? Just about. Not quite 50%, but close enough. Of a very easy question. We cannot afford to miss super easy questions. We just can't. Some questions are confusing. There is nothing we can do about it. But those questions, we cannot do that. Okay? We cannot afford to lose easy points. So from now on, please put you in your notes. PICO, cage, PDSA, frame, craft. Nah, not so much craft. But
Dr.
deep
Lopez,
yes.
I thought he's the patient or population. That's how I got it wrong.
Yeah,
I
patient of the
wasn't.
population.
Yeah, I didn't see
So
I didn't know that it was gonna be called problem too. So now
yeah,
I
a
know.
patient populational problem.
Okay.
Yes, patient populational problem. But what was the other option? I switched what was it? Clinical. I put clinical for comparison, right? So it I be, I'm telling you, easy questions, they'll find a way to make it hard. The easiest is the team, they'll find a way to complicate. And this is one of the ways to complicate pickup questions, right? But it's good. It's really good that we identified. We don't know what we don't know until we don't know, right? So it's good that we identify now, and we could, thank you, cage, frame, PDSA, okay? We got it. Frame is a beautiful question to know by the letter. Cage is another one. Oh my. My apologies on this question here.
Dr. Lopez,
Yeah, no.
level 2.
Yeah. Sorry. I just made it 15 minutes before the game started and I couldn't really double check my colleagues here. So I do apologize. This is a level 2, right? That's meant to say level 2. And this is the red one is level 1. Meta-analysis is level 1 or systemic review. This should have said level 2 high quality RTC. Okay. So I do apologize about that one. All right. So level 2, the hierarchies of evidence practice represent a high quality RTC study. So remember, what is a meta-analysis or systemic review is, think of a putting, I like to think this way. I don't know if it's politically correct. You put in like several RTCs in a blender and you blend them out, and then you come out with one final source of the truth, right? That would be a level 1. It's very difficult to come up with a level 1 because you may not have several RTCs or level 2 hierarchies of evidence-based practice. So usually, if we have a level 2 that's well done, double-blinded, randomized controlled trial, that should be good enough, especially if you have 1 or 2 or 3, right? Types of question, and they do not come together and create one article that finalizes all the 3 RTCs. That would be a systemic or meta-analysis. Okay. All right, perfect. Okay, at least not a lot of people picked the blue one. Remember when we talked yesterday about the cardiovascular surgeon, the best in the world, right? Well known. Where does his opinion stands in the hierarchies of things? Right at the bottom, together with the editorial. Yes, we're going to respect and we are going to listen. We're better, right? But what's the top of the pyramid, right? Meta-analysis, systemic review, randomized control trial. So would we talk to the cardiologist or would we look for the research and finding out what if there are randomized control trials or RTCs or systemic reviews, right? That's what the board wants you to do that. The board does not want you to do as usual, do what is the stand or what worked for a previous patient in the same scenario, or do what a more experienced PMHNP or psychiatrist would do in that situation. They always want you to go back to the research and find out. Let me give you a clear example. Very important, very important. Let's say someone is on medication X. And after you prescribe the medication and has been, I don't know, 4 weeks, 6 weeks, doesn't matter. FDA warning comes up on the news about medication X. Medication X can kill. Let's say that is the warning. What do? Option A, call the patient immediately and tell the patient to stop the medication X because it can kill, or option 2, look at the literature to find relevant research on the subject, 1 or 2. Who would call the patient, tell the patient to stop the medication because a FDA warning can kill? Let's say that is the warning. Nobody's going to pick one. So if you see on the news that medication X kills patient, no one's going to call the patient and say, stop the medication. No? I don't see nobody picking one, so that's good. All right. So the question is, what medication doesn't have FDA warning? Right? Lots of them do. Some can be mild. Some can be genetic, not about the medication, but the class of medication. So if you have FDA warning, it does not mean to stop the medication. It means is a warning. Watch out for possible side effects, right? Does not mean necessarily stop. But how do we know? We got to look at the research. Okay, very important scenario, even though it's kind of dramatic here to make a point, but always go back to the research. Now, ordering more labs to evaluate metabolic disturbance, does it change the outcome? Does it answer the question? Right? It doesn't necessarily answer the question. It is a right thing to do, but it doesn't answer the so what of the question. All right, so the initial step is to utilize evidence-based practice guideline, or CPG, that's also called CPG, to conduct a literature search to identify relevant research articles. Evidence-based practice involve integrating the best available evidence from the research into clinical decision-making. In this case, the PMHNP needs to find evidence-based guidelines or studies related to managing medication-related side effects in patients with schizophrenia. Okay, so keep that example of FDA warnings, because a lot of people kind of tunnel vision. Oh, it got an FDA warning, and then we forget to, hey, almost all medications have FDA warning. If not the medication, the class, right? So it's not that uncommon to have FDA warnings. All right, we got 10 seconds. Pick your best answer. Okay, guys. Do I care about the level of evidence? Yes, I do care, right? I care a lot. Because I can look at the research, I'm like, I don't like this. This was only done with white folks. Is this applicable to my patients? Oh, I don't like this. This was all done with the Asian population. Is this applicable to my population? Oh, by the way, the patients here, they all make above 150,000. So socially, economically well, They have good nutrition, everything. Is this applicable to my poor homeless population? So I do care about a lot about my level of evidence. What if my research or all editorial posting somewhere from somewhere? So the green option is a beautiful answer, but it comes with a very hard truth. What do we say? In order for an answer to be complete, the entire sentence needs to be complete. What spoiled the answer here, or one of the things, it says regardless of the evidence. So basically, I'm saying I can pick something from the trash and still evidence-based, I guess, is good, right? Compared to consult the clinical practice guideline, CPG, how to do things from a reputable psychiatric source. Much stronger answer, right? Rely on your clinical experience to determine the treatment plan. Not good. Remember, where is the expert of this world sits compared to evidence? Right at the bottom. When nothing else is available, we'll consult Mr. John, the expert in psychiatry or cardiology. His opinion is the least useful to me, right? Because his view of the world is all about his experience and what he has encountered. When we do research, is much broader, is much comprehensive than one person's point of view. Use a treatment that was effective for a similar patient. Again, do we specifically on module 5, we consult the research and tailor to the patient specific needs. Even if I have the best research, if my patient does not believe this medication will not work, that trumps even the research. They don't want the medication, so don't give them the medication, right? So psychiatry is not like black and white. We have to tailor, always look at the research and tailor for the patient, okay? Specifically on cultural questions, right? CPG is a great way of doing business, right? I have a folder that is this long of CPG. When I am in a austere environment where there is no internet, there is a lot of things going on, and I have no one to talk to, not even a phone, in the middle of the jungle somewhere, that's my Bible, a CPG this big for each one of the clinical guidelines. One of the most beautiful CPG is the Canadian bipolar CPG. Everyone must read that. It is so beautifully written. It tells you everything. It compares every meds. It compares lithium, Depakote, SGAs, first generation antipsychotics on how to manage bipolar. You should take the time and read the Canadian CPG for managing acute maintenance bipolar events. Okay, take the time. They will be very, very, very helpful to you in practice. Extremely helpful. It's called the Canadian CPG for mania. I'll search and try to put over here in the chat box for you. Yes, for managing manic patients. All right. So I was hoping that no one would pick the green. Like I have my Hispanic patient, and he comes to me. He's from Puerto Rico, and they'll say, "Well, sorry, I'm going to refer you to Dr. Lopez because I'm not Hispanic." We can't do that, right? I mean, we have to include cultural sensitive care. Uh, so including cultural backgrounds, beliefs, and use of this information in the care for the patient. So remember, it's always two things: research and culturally sensitive care.
Yeah, Dr.
Psychiatry.
Lopez, I chose that. It was a mistake. I wanted to keep
Okay, thank you.
blue.
It happens. I do it all the time because it's Kahoot. Kahoot is fast. But
Yeah.
I'm trying to make the point so that we make the mistake here and not during the test date. So how do you know it's a cultural question when they goes out of the way to say that the guy is from China or Zimbabwe or Hispanic? Like questions usually doesn't mention that very often. And then it comes with a specific symptom, a stomach upset, fever, diarrhea for children, evil eye, right? So comes with a bracelet or a feather or a healing stick. These are all kind of cultural, spiritual things that for cultural questions, okay? And then the hard part is for the test, answering in a way that's culturally sensitive. Very hard, especially if you're not in the course. Why? Let's say you have a child, 9 years old, comes in with a mother, and the mother is Hispanic, and says, "My child's having diarrhea for the last 2 days. He has not eaten or drink anything, and he has a fever," right? Gosh, I want to give him fluid, right? He is dehydrated. I can barely see his vein. But what would be the right answer? And you see that the child has a red bracelet, and then you kind of understand that this is a cultural syndrome. So answers like that would be educate me, help me understand what this red bracelet does for your child. And that would be like, no, please, let's give him fluid, right? But that would be the incorrect answer. So it's very important that you understand cultural questions because they become easy. Once you see it's cultural, fight the urge to pick the scientifically sound answer and pick the answer for your points. Okay. And I'll leave it at that. Please read the question carefully. All right. Okay, perfect. All right. So transfer the patient to a locked psychiatric unit for safety during the treatment. Sure, the patient is schizophrenic in acute psychosis. Most likely, this is what we'll do. But compared to assess the patient's condition, what we do always first is assess and consider less restrictive options, right? Consider doesn't mean this is what we are going to do, right? But first thing we do is assess, and then from there we'll make a plan. caffeine got on fire there. Noah B, it's been on first place for a long time. See, okay. So remember the 3 patients, right? I think I mentioned this a minimum 10 times since Tuesday, right? Because they will come to be helpful. In fact, I almost think with 100% certainty, there is nothing in the course that is a waste of time. If it's in there, there is a purpose. Everything was thought out, so it doesn't waste your time. So if you see something you don't understand, ask, because it's there for a reason. Okay, is that to help you? Is that because we see broad questions in psychiatry to be related to that specific topic, right? So if I repeat it 10 times, what are the 3 patients right? They are important, right? How do we advocate for mental health? That is the theme of the question. We covered this too. Or policies making. All right, so the question here is the components of health policy, not necessarily advocating, okay? All right. So what are the components of health policy that we covered yesterday? When policies are made, we look at the place, we look at the implementation, evaluation, right? Formulation, implementation, regulations to improve access to mental health, which is what we advocate for, is one of the essential components of a health policy. Health policy involves development, implementation, and evaluation. We cover as formulation rather than saying development, right? Same thing. So development, formulation, implementation, evaluation. FIE for policy making. Then we went on to say where it's being addressed. Is it in a hospital? Is it in a community? Then we went on to say, who do we address first? Do we go straight to the stakeholders, or we do barriers and facilitators for implementing evidence-based practice? Okay. So, okay. All right, last question. How do you reduce the stigma of mental health? This is in the community, right? You want to decrease mental health in the community. You want your voice to be heard. Do you do it at the community center one time? Do you do it where your voice can be heard in a radio, TV show, to embrace and educate mental health changes, right? So you want to media outlets to share personal stories of individuals who have overcome mental health challenges, can humanize the experience, which is decrease the stigma of mental health of those with mental illness and reduce the stigma, right? Okay, so good job, everyone. This is it for today. So let's see who made it the podium. I can't see. Kibi, good job. All right, Noah, good job. You guys are all PMHNP. You've been here for a little while. I'll bet you fan, and the fifth person I missed there, it was too fast. You guys, everyone is doing awesome. I think it is always better to learn by mistake. I was reading a research article today as I was waiting for my turn to be a patient, right? People learn more from doing questions than they may actually learn from reading or a lecture. So this is what we did today. What we know, even though yesterday I kind of said it 5 times, please no pico, please no pico. Now we learn by mistakes, right? A lot of things that we covered yesterday, we practiced today. So everyone's goal by the end of the week is to finish module 5. Question bank, because this is just a
We don't hear you, Dr. Lopes.
Thank you. I was saying that everyone's goal for this week is to complete the question bank. We just went over module 5. You should hop on and do those 100, 120 questions. I don't remember how many questions are there, and finish your module 5 question bank. Remember, as you are doing the modules independently, then follow up with the question banks again. Next week, we are going to module 1 or domain 1, scientific foundation. Remember, will be 8 o'clock, not 7. 7 o'clock is the usual standard time, but I need at least 1 hour to come back and be on time, just to be sure. Okay, I'll send the link over the weekend. I have a lot of emails to answer. I owe you few emails back. Just give me a little bit of time by Saturday. I'll be able to be down to 0 again. But you guys, it was always a blessing. Hopefully we learned a lot together. We learned by making mistakes. Let's answer some questions here. If you have nothing else, have a great night, and I'll see you next Tuesday, 8 p.m. Eastern Standard Time. We're going to do a little deviation from our regular time. D, do you have a question? Thank you, everyone. AJ, Jamie, Mike, Mitchell, Fate, Rita. So many of you guys here. Good night, everyone. D, do you have a quick question? Jessica, Noni, Floppy, Carla. Carla, you should be taking your test soon. I think always the other Carla.
Dr. Lopes.
Hi.
Hi.
Hello, Judy.
Hi. I have 2 more weeks to test. So
2 more weeks. Okay.
Yeah.
Go ahead.
So the PICO, I've always thought it was the population or the patient. How come it's the problem now?
What problem?
Oh.
Yeah, it can be a problem that you are solving, not necessarily a patient.
Okay.
It can be also a problem. Yeah.
So it can be
patient,
problem,
population,
patient.
or problem.
Okay.
Okay. But most of the time, we hear patient or population, which is the same thing. But we can do a research to solve a problem. It doesn't have to be a patient, right?
Okay.
Because if we have a problem in the ER, how are we going to conduct our research? We need to solve the problem of why the patient is taking too long from the ED to the psych unit.
Okay. That's where I got thrown off from that, because I've always known to be the patient or population.
And it's beautiful. And this is why we do Kahoot. This is why we do the question bank, so we can find those minute difference. All right. So, D, do you have a question? You are muted.
Yes, Dr. Lopez.
Hi.
Good evening.
Good evening.
Yes, I have been in this program for a while.
Okay.
So I felt like I am ready to do my exam now.
Okay.
I already had set up a date, everything.
Okay.
So today I tried the pre-test. I don't know, I was so anxious. What I decided to go and try the dummy test at the center so that I can little bit ease my anxiety. So, but I was very anxious there, and I failed it again today. Today it was my first time, so I failed it. So the questions were similar, but again it was my time management. So if I say about the program, I'm doing very well with all the materials, all the Q banks, all the diagnostic tests. I never 50%.
All of them. If you want if y'all want the VA to pay it, that's fine.
All right. Sorry about that. Go ahead, please.
Okay. I never received less than 80% in any module or any diagnostic test or any crash course ever. So what do you suggest in this situation? Like, I'm doing my real exam in 10 days. I feel like I'm ready with all the material, with the Q banks. What do you suggest other than that, like so that I don't get do something extra, like a focus on something specific, 1 to 3 modules again?
Okay. So I think I am confused, and the person that just put the question, she's also confused. You said you're doing well on the diagnostic test question bank, but then you said you failed a test, a dummy test. What test are you referring to?
Yeah, it is a test like a SEM, like or real exam. We can go to the center.
Oh, hold on. Hold on. Now you are clarifying.
Yes.
Okay. So what is what was your score?
So I failed by 2 questions.
You have nothing to worry about.
Okay.
I can pull my email right now, and I can pull you at least 20 students that ask me exactly the same question. I think out of those 20 students that answer exactly the same question, only one had scored 72. Are you let me make sure. Are you referring to the pre-exam or dummy practice exam for the ANCC?
Right.
And you score 68.
It was about 60% because it was a 60 question.
Yeah. So you look,
Speaking to admission?
you don't have a whole lot to worry about. Okay. So have you done diagnostic tests 1, 2, 3, and 4?
I done twice now, and now second time I'm getting 98%, 99%. Like initially received 85, 95, 92, like that. Yeah.
Okay. I want to know the first time though, like the first time you took all of them.
Okay, first time for first diagnostic test I got 91%, second I got 85%, third I got 89.9 something percent, and for the fourth one I received 92 or 93%.
So you saying the first time you took my diagnostic test, after you finished the course, these are your scores?
Yes.
You have nothing to worry about. You have over 95% chance of passing.
Thank you. Yeah.
So don't hype yourself. You know, I was talking to my kid yesterday. You know, she's 9 years old. She said, "Daddy, stop hyping me up. You know, I can't sleep." You know, I was kind of playing with her. It's like, "Daddy, you hyping me up. I'm gonna be up all night." So don't hype yourself. The test you took causes more anxiety than is actually worth anything. I can pull up my email right now, and I can tell you in the last 45 days, I got exactly 20 different students with exactly the same problem. And that from short memory, I cannot remember one of them that failed the test. I can tell you 10 names from off the top of my head right now. So what you need to do is focus on your diagnostic test. I mean, sorry, let me take that back. Focus on your crash course review. If all possible, may not be possible, attend the next crash course review. If it's not possible, it's okay. You've been in the course for a while, you're ready. Now, make sure you know my crash course review material inside and out. And I'm telling you, have over 95% chance of passing. I'm not concerned at all. If that's the test score that you gave me is the first time, right?
Yes.
I'm not concerned. Now, I would be concerned if the first time you took a 60 and then you got 90 after, then I don't know if this a true knowledge or this is a memorization. I can't help at that point. And this is why I really enforce take the diagnostic test when you're ready. So that way you know what you don't know. And then we can have a good assessment of, very seldom when you guys score more than 80 on all 4 diagnostic tests, someone doesn't pass. Almost never. We are talking about less than 1% chance. So really, then what you have, a 99% passing rate, right? Chance of passing the first time. So it's really almost impossible. Now, let's be honest. Sometimes we get so nervous we don't even remember our social security number, right? Doesn't mean we don't know our social security number. It just means we're very please note these documents in and out. Go through them in and out, and then just review and relax. The night before your test, go celebrate.
Yeah, this material I can say like I mix in a water and I drank like this much how much I'm prepared for this material.
So you don't have nothing to worry about. So what you need to do is some exercising, good sleep, and what I'm saying is don't hype yourself. The night before, take your spouse for dinner, take your kids, your family, go celebrate because you already got it.
Brainstorming was I feel like brainstorming was my issue and time management was the issue. I know
Right.
those 60 questions cannot judge my knowledge, whatever I know, but still whatever I experienced today that I am sharing with you.
Yeah. So what I want you to do is, the question bank now has time on it. Stick to 1 minute per question. Analyze it. Go with your gut because you already got the knowledge, and don't change your answer. And you got to keep on moving. If you feel that you look at the clock, it's been more than 2 minutes in that question, flag it, cross 2 out, and come back to it later. Do not spend more than really is 1 minute and 20 seconds per question. Otherwise, you're going to shorten maybe another question that otherwise you would have got it right because you spent 5 minutes on a question trying to, I'll remember this. You got to let it go, learning to let it go because you have other questions to take care of. Okay?
Sounds good. Thank you so much, Dr.
All right. Good luck on your test, and I'll be looking forward to see your name as the next PMHNP. Okay?
Sounds good. Thank you so much.
My pleasure. Bobby.
Hello, Dr. Lopez.
Hello.
I think you may have answered my questions by answering hers because I test Saturday.
Okay.
And I've taken all the diagnostic tests and done all the modules. I got 85 consecutively on all 4 diagnostic tests. I was just wondering what you thought I should do tomorrow before my test Saturday.
Saturday, right? The right answer is to relax and do nothing more. Now, have you really looked at those PDFs really well?
Yes.
Then maybe just those 2 PDFs, just a quick look in the morning.
Okay.
And then move on. Don't stress yourself out if you at nighttime, if you can go to a movie early, not you don't want to go to a scary movie so your norepinephrine will be activated. But something to relax. Just it's not going. It is what it is. You've done your thing, and then Saturday, you're the next one being qualified. That's as simple as that.
Okay. Thank you so much.
Good luck.
Thank you.
All right. Emmanuel.
Good evening, Dr. Lopez.
Good evening. How are you?
I'm blessed and Happy New Year to you once more.
Happy New Year's, yes.
2 questions actually. One is I have done all the question banks. I also have did all the PDFs. And I started the diagnostic test. I did diagnostic test 1 and 2. Then noticed that there is this link you sent us for crash course questions, 6 of them. So I paused doing the diagnostic test and went there to do them. And I've done up to 1, 2, 3, 4, and I'm in the 5th. And I noticed that it keeps logging me out.
Oh.
Midway, and when it comes back on, it takes me back to 0, back to question 1 actually. So, and I'm rushing to go back to complete my diagnostic test 3 and 4. So I have to pick up a date for I have not picked it down until I'm sure of what I'm doing. So one is if this thing has the glitch has been fixed, because it takes me forever. So question 5 took me up to 4 days, because I just keep going. When I go to do something, when I come back, it takes maybe I've gone up to 65th question, and I go back to question number 1 again. So
okay, so
that's
I mean,
kind of frustrating.
But let me.
I sent you an email this morning.
Okay.
Because of that, I sent you an email.
But here's the thing: these are supposed to be done in one setting. I think you are hurting yourself by doing those in 4 days. So there is nothing, the system can't hold your answers there for 4 days.
No, it keeps me up within hours, not 4 days. It
okay.
keeps me up within hours, not 4 days. What I mean by 4 days is that it keeps me out. Then I come back to do it again. I'll do up to say question number 70, and I take a pause. When I come back, I'm back to question 1.
So how much is the pause? How long is the pause?
Sometimes 2 hours. And
I'll take a look on it.
Yeah, when I did questions, crash course day 1 and 2, I had no such problems.
Okay, I'll take a look. I'll take a look on it. Maybe there is something in the back end that is different. But I haven't heard anyone else. Are you doing this on your computer?
Yes, sir.
Okay. All right. I will. Once I look at your email, it will cue me to go ahead and look at the back end, see if it's something that I can do different. I'll compare.
Actually, 2 or 3 people have made some comments in the WhatsApp page, so it's not
right.
just me.
So what usually happens is that people using their iPad or phone, and as they scroll up and down, the answers get changed. But I haven't heard that one yet. But I will take a look. It may be something that is different between 1 and 2. It shouldn't. I would suggest maybe try a different browser. But let me take a look in the back end, see what I can do.
Okay.
Maybe it could be something that's a small tweak. I don't know. I'm going to look at it.
All right. My next question is the status of law, which we discussed today. We said call the law enforcement, but my understanding is that you should inform the intending victim.
Okay.
So I answered the last question. I picked up the option that says call the law enforcement, but I just want a clarification on why you should, why we should call the intended victim, which is what the law says.
Oh, is it what the law says?
I think so. That's what I thought.
No, I mean, maybe in your state, but do you know if this is true for every state?
No, it's from this particular review. Maybe I got it wrong.
No, not for my review.
Okay.
The law is not specific for every state. Each state is dictated by the scope of practice. Just like in Maryland, I can practice independently. In Texas, I can't. So the same thing is this principle. It is true for California, but it's not true for every state. And that is the reason why you cannot, and you are taking a national board. So if it's not true for my state and it is true for your state, but we are taking the same test, that cannot be the right answer.
Okay.
Does it make sense? Because it's not true for every state. What if you actually inform the possible imminent victim and she got a shotgun, and as soon as she saw someone in the front door, and she actually did something, right? I mean, I'm creating scenarios here. You may not have a leg to stand on when it comes to court because it's not applicable to your state. If you live in the state that's not applicable. So remember, you are taking a national test, which is true answer for everyone. So it can only be a true answer is calling the police or calling your state board of nursing. I know that is not a sexy answer, but it solves the problem. Can I call my state board of nursing and ask what they can and cannot do? Asking guidance, what is allowed or not allowed in my state? Yes, I can do that.
All right, Dr. Lopez, thank you so much.
My pleasure. Yes, appreciate the question because it's good that we always get those small things cleared out before the test day. Okay.
Thank you.
Thank you, Manuel. Appreciate it. Mrs. Gertrude. Sorry if I butcher your name. You are muted. If you can unmute yourself. Mrs. Gertrude, are you there? We'll come back to you, or anytime you unmute yourself, you can speak, okay? Sharon?
Yes, Dr. Lopez.
Hello.
Hi, how are you? And thank you so much
Good.
for your Kahoot.
Yes.
I am trying to test maybe in the next 4 weeks, maybe 6 weeks.
Okay.
I'm trying to friend you on Facebook because I have a question about your program. I don't currently have a program, but my friend told me about yours.
Okay.
So when you get a chance, you can accept my friend request and then we can talk.
Sure. I will do that as soon as we are done here. But you also okay. Let me.
In a nutshell, I'm just basically trying to find out if there are any sales or will there be any sales.
Yes.
Things are a little bit tight at the moment.
Yes.
So.
No problem. That's too easy. We can always take care of that. Let me put the link here, and then let me give you a code. Is that okay?
Okay, perfect. Thank you.
Let me find if there is one here.
It's going to be next Friday on payday before I can get it, though.
Yeah, no problem. There's no worries. You know, all what I ask of you is not to rush the process. You are not necessarily held for 30 days. You can stay with me for 8 weeks, 10 weeks. What I really want is that you pass the board. Okay.
Well, I've been watching your free videos on YouTube. I have been watching them, so I have learned a lot.
Here you go. Use this code here. It should work. If it doesn't, you can always give me an email. So, yeah. Well, welcome to the program. Whenever you come in, it's okay. So hopefully I'll see you next week. So.
Yeah. Yes, I'm going to try to do the Kahoot again. This was helpful. Thank you so much.
Good. My pleasure. All right. Mrs. Gertrude Ogie, are you there? Judy, do you have another question?
Yes, Dr. Lopez.
Hi.
I wanted to ask you the crash course questions. So I went by mistake. I went to the 5th one, and I did it, and it said 70% is the passing grade for that one, and I got 74. So I don't know because that's fine. Those questions. They don't relate with what is in the crash course. I don't know where those questions came from, and they kind of scared me a little bit because it's off completely.
No, they relate to the crash course.
A lot of them didn't, like the cancer, the polymyositis, bone marrow, anemia. We didn't cover a lot of those in crash course program. So
we cover them on the crash course. They all. We cover, for example, Lexapro, the least, and we cover that on module 1. The least.
Where did the polymyositis came from? Because I don't know, it wasn't in the crash course.
What do you ask? I'm sorry.
Polymyositis, that's one of the conditions in the questions, and we didn't cover that. It says polymyositis.
I would have to look where we cover, but all those questions have
Bone
been,
marrow.
yes, bone marrow deficiency. I would have to, I would remember
Case of
exactly where.
anemia. Yeah.
We did cover anemia in the crash course review too, though. Remember,
So, but what
the
70% is a passing grade for that one, and I scored 74.
so it's nothing to worry about because they are what they are is simple views of those modules here. So I copy and paste specifically this one, the part 2, right? So I copy and paste that and then translate into questions. So it's kind of like, okay, what can I make it a question and pretty much put it back what's written in here, right? So I said, hey, then I do a cultural syndrome, and then I do a suicidal question, and then I do a somatic symptoms question, then I went attacking the nervous, and then I went on and on and on each one of these questions, kind of like these points. See, this is about anemia. We talked about anemia, FDA warnings, Depakote. That's what it is. But it might be I see a plastic anemia. Well, that too we talked. I mean, I will have to look at it, but
Do we have to finish the crash course before doing the diagnostic?
it would be wise to. Why? Tell me what would be the reason for not finishing the crash
I don't
course.
want to, like, I don't want to forget things before going to do the diagnostic while I'm spending time doing the 600 questions, and I haven't even
Well,
done.
you know, you are doing the crash course review when you are doing those 600 questions. And then you watch the videos and then watch the modules, PDF, and then you take the diagnostic. What you don't want to do is go in the diagnostic and, I mean, everything is a balance, right? So what you don't want to do is save it too long until the week of the test, but you don't want to also skip it and go straight into it and get a low grade, and now you have to do it, and then neither you and I know where we stand. So you have to do modules 1 through 5, do the crash course, and then in your mind have a test date, which is not the real test date, but is your diagnostic test, and you sit down and you do it that date that you said you would. And then from the first one, you're going to learn from some things that you don't know. Oh, I didn't know PICO. Now you go back, revise it, and then maybe a day or 2 later, try again. So basically, give you 4 times the opportunity to find out what you don't know.
Can I do 2 of the crash course tests in one day?
Why would you do that though? Like, you are wasting your crash course review, because mentally it's pretty tough to do 7 hours of testing. That would be a true, that would not be a true effort on your end, and you most likely would score lower. I'm trying to say, like, is it reasonable to test for 7 hours? Probably not. 3.5 is long enough.
One question is for 3 hours, right?
All of them are 3.5 hours.
Oh, okay.
So the right way of doing it, or in my mind, is doing it, pausing it, looking at what you don't know, go back to your notes, revise it, test it again. Pause it, revise it, what you don't know, or what you thought you knew it, but you got it wrong, and then test it again. So that way you are continuously improving rather than taking a test for saying check mark, completed, right? But it's all, again, it's all about time management. Maybe you are testing Saturday. Maybe there is a reason why you're asking.
No, I have 2 weeks.
Yeah, so I think
I have 6 questions and I have 4 questions over on the diagnostic. So I don't know how much time I'm gonna be able to.
Yeah, just finish your crash course review this week. Put all your PDFs on the table, go through them quickly, and then take your diagnostic test 1, and then pause it again. Take your diagnostic test 2. Come to module 1 class and keep on going. Okay. But make sure you know the crash course review modules really, really well.
Okay.
All right.
Thank you.
Thank you. All right. Next person is Faye.
Hi, Dr. Lopez.
Hi.
I think you've answered most of the question that I have, but the other question that I have is that this 600 questions, are we supposed to answer it in one sitting?
No, no. I mean, it's supposed to be for the crash course week, right? Crash course review week.
Okay.
So during the crash course review week, we will not have Kahoot. We will not have live class. So it's a free week to answer those questions, 600 questions.
Okay.
So as we prepare for the crash course, that's when you should do it. But some people are testing soon. They wanted it again, or they just joined the course 3 weeks ago and they didn't have it. That's why I sent it out for everybody.
Yeah. Okay. Because I just started. I'm still going through my
Do not
module
worry.
one.
Yeah, you should not be worried about those questions at all. You should just
Okay.
worry about your mod. Continue on your module and doing your
Okay.
question bank.
Okay. Thank you, sir.
My pleasure. Floor.
Good night.
Good night.
Hello, Dr. Lopez.
Hi.
Hi. So I just quick question. So I know that you're super busy, but are
no
we
problem.
expecting to receive for the live course links for the next week?
Yes, that will be
Okay.
over the weekend. By probably by Sunday. If
Okay.
not Saturday, you get the live for module.
Okay.
Now,
Okay.
if you are new, make sure that I just uploaded this on the homepage. This video that really goes through everything you guys need to know. Please make sure you watch it because it's going to be
Okay.
very helpful.
Okay.
Thank you.
Thank you so much.
My
Thank
pleasure.
you.
Thanks for being here.
Mhm.
Noni.
Hi, Dr. Lopez.
Hello. Hi.
Just a quick question.
Sure.
Do you have any idea when the February crash course would be?
21st, 22nd. Is that a Saturday and Sunday? If it is the right date.
Okay. It's not 20. Okay, so 21st, 22nd.
Yeah, if that falls in a Saturday and Sunday, that is the right date. I can always
Okay.
look it up.
Okay, because
With the schedules done, I just gotta send it out to you guys. Lola, stop. You gotta send it out to you guys the schedule, but you guys be getting that over the weekend.
okay. Thank you.
My pleasure. Yeah, it's a good question because you can always time yourself to test after the crash course review. Great strategy. Lorene.
Hi, yes, I had a question
Sure.
regarding how a brain with depression appears on an MRI. So specifically the amygdala and the hippocampus, are they decreased or increased? I couldn't hear it well on the video because I'm reviewing the recorded crash course. So I needed that clarified.
Which condition?
For depression. So like, you know
Oh.
how, yeah. So for like a schizophrenic patient, their MRI will show enlarged ventricles, but for a
Right.
patient with depression,
Decreased.
okay,
Depression.
the amygdala and the hippocampus will be decreased.
Yes.
Okay, that's what I thought, but I was like, wait, what am I hearing? Okay,
Yeah,
I appreciate the clarification.
My pleasure. All right. Any other question? Lorraine? Nope. Mrs.
No, thank you.
Awesome. All right. Oludumila.
Hi, Dr. Lopez.
Hi.
Happy New Year.
Happy New Year's. Yes.
I emailed you, but you never responded to my email.
Like I said, I just made it 10 minutes before the class. So I am behind about 2 days and I probably have 100 emails to answer. Honestly, I do have more than 100. But by Saturday, I'll be getting back to everyone unless if it's extremely urgent. If you're comfortable, you can ask now, but I will get back to you very soon.
Okay, no problem. I'll wait. That's fine.
Okay. All right. If it's urgent, you let me know, okay?
Yes, I just want you to tell me what to do next. But I emailed you. I want you to look at it and then tell me.
Yes. I'll
Thank
definitely
you.
take a look at it and give you my best advice.
All
Okay?
right. Thank you. Yes,
Thank
sir.
you.
Okay, bye-bye.
All right, good night. Folks, remember, if you're new to the course, the first thing you do is take the diagnostic test. Please do not look at your answers. All you need to know is your grade, nothing else. I know that's tempting, but why not look at the answers? Because you are going to take the same test later. If the education provided was helpful and you were able to keep it, you should score higher next time. This is a hard test. Most of the people score in the 58 is the medium grade here, right? So you take the test, forget about it. If you're scoring above 70, you know you're really doing well. If you're scoring really low, then you know, game on. We got to study together. We got to make sure that we're on pace. My recommendation is 1 module per week. Oh, that's going to be over 30 days. Yes. Am I going to charge you? No, no. I am dead center focused on your success. Once you're in the course, we are touched. We are not going nowhere until you pass. Okay. So the best way of doing that is not rushing through the content. There's a lot of things to cover, and even though it's diluted, broke it down in smaller content, still a lot. So I want to see you pass. I want to see you doing well. So I don't want you to rush. You can come to as many live classes as you want. I'll support you, emails, all the way. If it takes you 3 months, doesn't matter for me. You can come to 3 crash course review for all I care. In fact, I want you to come. So don't think this is like, oh, I can only come to 1 class. Oh, I can almost my 30 days, I have to pay more. No, you don't have to pay anything. Okay. So just want to put that out there because I got a phone call today. The guy was rushing and he was like, oh my God, I'm testing February 2nd. I'm like, please don't rush. Your success is a lot more important. This is not about, there won't be charges. There is not automatically enrollment that you pay next month. It's all included. This is what we do. Okay. Anybody else has any other questions or any concerns, anything that's in your mind?
Hello.
Hello, Latoya.
My question is, you know how when you are doing the live courses and then you send out those questions, are they the same questions that you send out each time you are doing the live course?
The live course, you mean the crash course?
Crash, yeah, where you send out like 600 questions.
Same ones.
Okay.
Some ones. So yes, same ones. It's just that new people come in and some people can't find it. They say they never receive it or they deleted their email. So I send it out for everyone. Say, hey, if you want to go at it, I don't know if you're testing soon. If you cover everything, you don't know what to do. In fact, thanks for that. Actually, if you don't know what to do, please watch Module 12. Go to all trainings. Once again, let me go back to homepage. I really wish people take the time to watch Module 12 because that is one-to-ones. That I took the time and I spent 3-4 hours with those students, and then you can benefit from it. Module 11, and my apologies. Module 11 right here, it's student meetings, right? So this is a good place to play it while you are on your car, right? So all you do is
those.
So basically, I'll ask them some free questions. This is something that just do.
Smoking adjustments on meds, right? If they are smoking, it is inducer or inhibitor.
See, so it'll be free flow on the moment, kind of quizzing the person. I get a lot of good feedback from those types of styles of teaching because they're impromptu. It's like I'm quizzing him live. Nowhere to look at it, no papers. Or either he knows or he doesn't. And I did this with a few other students. So that's a good place to, if you already cover everything, take a look at it. Maybe it's worth your time, okay?
Okay, thank you. And then I also sent you an email because, like before I was saying I wasn't getting the emails. And I sent you the email, you responded, you asked me like what my schedule was for testing. And you're going to reach back out to me with, some type of guidance. So I wasn't sure if you had responded to it and I just wasn't getting the email.
No.
But I know you said you were going to try to reach to everyone on Saturday.
Yes. I almost want you to, if I'm not sure if it's possible to delay it a little bit. But what I'm trying to say is, I looked at your stuff and you're doing okay, but I think significantly you could improve a little, slightly more, or increase your chance of passing if you waited a little bit more. But I don't remember if you're in a tight schedule. Maybe you have a job lined up, or maybe you have a AIT, not AIT, testing date that will expire, and then you have to submit everything again. I don't remember specific your circumstance, but I just know, I think I looked at your stuff. You were enrolled, but not active until a few weeks back. Is that correct?
Yes, that's correct. Just because like I was still in school and
No,
just
that's
a tight schedule.
right.
And I'm just now kind of, but I did take like a week and a half from work to dedicate to just completely, studying and going over the material.
Yeah, but here's the thing, Latoya. 1 in a week and a half is great. And it's very possible that you can do it and other people can do it. But you are rushing, because each module will take 5 hours of lecture plus another 3 hours of question banks. That's 9 hours per day. And the next day you would do it again, and then you do it again. And then it comes the crash course review, which is 16 hours, right? So what I'm trying to say is that even though it's 1.5 week of a very strong effort and studying, you are not giving your hippocampus enough time to sleep, digest, and review the information again. You are jumping to the next thing and the next thing. So it's very likely that you might feel overloaded. And not you, generally speaking, right? So it's one of those things, if you are comfortable, I 100% support it. And how do we know, right? When it comes to your diagnostic test, that's going to be the true answer. Because maybe you are one that can digest 5 hours of information and still remember 2 weeks later, right? So usually that is a lot of content to digest in a small amount of time.
Okay, thank you.
But we'll talk. I think the time that you are off work is going to be used wisely. Is going to be on it, and I can't say that's true to you, but we'll see during the diagnostic test. That is the ultimate answer. If you are scoring 80s, above 80s, above 80, please by no means do not reschedule test. Go on. But I think it's when it comes to the crash course review, it's 16 hours crash course review. So that alone is going to eat up at least 2 days just to watch it. Now think about it, going over the material. Again, keep it the schedule as you have it, keep going at it, keep pushing for the date that you have, because none of that is going to be wasted. We can only get better. And then when it comes to when it comes to the diagnostic task, then we can make adjustment as needed. Okay.
Okay, thank you.
Thank you, Latoya. But I will respond with a little bit more of a planning towards you. Okay.
Sounds good. Thank you.
All right. Anybody else has any other questions, concerns, or ideas, or anything that's in your mind? All right, folks. I gotta go have dinner. All right. So it's good to see you guys. And
Thank you.
thank you. My pleasure. I'll see you next Tuesday, 8 o'clock. We'll start from module 1. So your goal now is you finish module 5, go do the question bank on module 5. Right? Go do the question bank on module 5. And then when you do it on your own, do the question bank on module 5 again. Okay? Good night, everyone. It's very nice to see everyone as always. See you next Tuesday, 8 o'clock this time. Okay? Bye. I'll send an email.
Thank you. Good night.
Thank you,
Thank
Noni.
you.
Thank you, Claudia.
Thank
Claudia,
you.
haven't seen you in a long time. Hello, Micho.
Okay, thank you.
Lisa, hi. All right, everyone. Good night.